Hi, so today I'm going to talk about a rare disease perspective on understanding the relationship between online health information, health anxiety, and trust. So just a little bit of background about this. In the UK, a disease is said to be rare if it affects less than 1 in 2,000 people. Now, that's obviously a very, very small minority of people. And because of that low prevalence, it can take a very, very long time to diagnose. And from this delayed diagnosis, actually, it can have really, really debilitating effects on patients' health. And it can have really severe consequences, and they end up often playing catch up for the rest of their treatments when they do finally get a diagnosis. So it's really, really harmful for patients' health, but it's also a big burden on the NHS. So in a period of 10 years, it costs the NHS in excess of £3.4 billion through this diagnosis. And a lot of that money would go on things like missed treatments and tests that for diseases they don't have. So actually to get this diagnosis sooner would not only save money for the NHS, but it would also be really, really good for rare disease patients. And online health information is also a really, really powerful tool to empower patients to take a more active role in their healthcare. But it's especially important for rare disease patients who to have more control and input in their health, because they're often passed around from one specialist to another, and it can be quite chaotic, but having control of their health with online health information can be really, really powerful and supportive for rare disease patients. But one big issue with online health information is the effects it has on health anxiety. So it's been known to increase health anxiety for the worried well, and a number of researchers have looked into quantifying this, but very few actually look at addressing this. But White and Horvitz actually have done quite substantial work on looking at addressing this. But one thing that's important to consider is how this affects trust. Does these methods to reduce the health anxiety for the worried well, does it prevent the action of the worried unwell? Does it then neglect to promote the people who need to seek help to get that help? So this brings on to my project. So some of the aims of the project, firstly, to design and conduct a study that looked into this, and using this study to analyse and extract what are the key methods that not only reduce health anxiety, but also that don't prevent the action of those who need to seek help. And using this, I could create a design space for future researchers and for future research to make sure that it's it adheres to these principles. Just how did I do this? So I recruited a number of participants through social media and email, 80 participants in total. And that was targeting rare disease patient groups on Facebook, given the permission from the admin, and email to Swansea University students. And using this, these participants were given a questionnaire and an interview. And these qualitative information was then analysed through thematic analysis. So some of the key findings were you can actually predict and detect anxious behaviour from things like user logs and user behaviour. So when you detect this, you can actually predict and prevent these escalations. But also from detecting this, we can detect what websites often lead to escalations, what websites often lead to increased health anxiety, and maybe demote some of the websites that are unnecessarily escalatory. But also, one key issue that I found from the questionnaires and interviews that arose was a difficulty understanding health information and a difficulty interpreting all the vast amount of information on the page. So using visual prompts where possible could be really, really helpful and really insightful for patients looking into their own health. So that's really, really powerful. But another big issue is the lack of reliability of online. So many participants were aware of the issues with reliability when looking at online health information. And actually that was that was a source of anxiety. So to be able to have experts, so to have medical like healthcare workers to assess the reliability of websites could be really, really powerful to then show this reliability rating for some of the key websites that are used. And this could just reduce that extra strain on patients looking for their health information. So there were some really interesting topics in that, and overall I would say this project achieved its aims, but there's vast amounts of room for future work. So one thing that arose from this study, which would be really, really valuable to look into, is the effect of online health information on doctor-patient relationships, but also with a rare disease perspective. It's often doctor-patient relationships are actually, that trust is diminished because they have this diagnostic odyssey. So how do we look into promoting healthy doctor-patient relationships? And that could be a really interesting area for future research. But also, I mentioned about using visual stimulants would help to clarify information, but that's very, very broad. So some research into looking into what are the key communication tools that really help online health information users. So that's overall a summary of my master's project. But moving on from this, now I'm looking at exploring patient-focused and machine learning interventions for rare disease diagnosis. And that consists of a digital-based patient-held intervention. So using data-driven analysis of patient-collected health journeys to promote and encourage greater conversations with their healthcare providers. It's really important that actually it's powerful conversations with rare disease patients and their doctors that often result in the final diagnosis. It's these conversations that are really important for the doctors to understand some significant symptoms and significant issues that the patients are facing. So that's my talk. So here are the references from my talk. So thank you so much for listening. Do you have any questions?